Retained blood syndrome. Causes and complications. Chest tubes put in place following cardiothoracic surgery often become blocked by coagulated blood. In fact, a recent prospective study found that 1 in 3 patients suffer from completely blocked chest tubes. And 86% of these occlusions occur below the skin, where they cannot be seen by caregivers. Clear chest tubes allow blood to drain freely. But chest tubes that have become clogged can cause decreased flow, which can lead to retained blood pooling in the chest cavity. This pooling of blood can lead to retained blood syndrome, or RBS, a collection of complications ranging from tamponade and hemothorax to pleural and pericardial effusions. RBS can then lead to inflammation that causes even further complications. So how does this happen? As retained blood collects in the chest cavity, it begins to clot, which begins a cascade of events triggering an inflammatory response. First, red blood cell hemolysis and pro-inflammatory recruitment of white blood cells leads to free radical release and the production of reactive oxygen species. Free radicals and reactive oxygen species then cause lipid peroxidation, which results in the breakdown of cell membranes, leading to tissue damage, as indicated by increased local biomarkers. This kind of myocardial damage, triggered by retained blood and oxidative stress, can trigger postoperative atrial fibrillation, or POAF, in some patients with susceptible atrial substrate. POAF plus the previously mentioned range of RBS complications result in poor outcomes for patients. Patients with RBS interventions have been shown to have increased ventilation time and infections, longer ICU stays, as well as increased mortality and 30-day readmissions. That's why the ERAS Cardiac Society guidelines, published in JAMA Surgery, recommend maintaining chest tube patency to reduce and prevent retained blood. Additionally, stripping or breaking the sterile field of chest tubes to remove clots is not recommended. To learn more about preventing and minimizing retained blood syndrome, visit clearflow.com.